The earliest symptom of hyponatremia is option A, fatigue. The earliest sign of hypocalcemia is answer A, twitching. Patient has vitals BP 120/66, pulse 88, SpO2 99%, aura 23. The patient should be classified in which triage? Green. Patient has temperature 104 degrees Fahrenheit, BP 140/90 mmHg, aura 28 per minute, pain score 5. Which factor will you primarily manage? Temperature 104. Patient has temperature 103 degrees Fahrenheit, heart rate 110 per minute, aura 23 per minute, BP 132/66. Which factor will you primarily manage? A. Temperature. According to ABC, which of the following describe improper cardiac circulation? Answer A. Hypotension. During IV administration, which drug causes extravasation and damage to the site? Answer C. Phenytoin. The translamination procedure is done with A. Vein puncture. Normal compression to ventilation ratio. Answer is A. 30:2. The fetal rate gradually decreases and returns to baseline with the nadir occurring after the peak of each uterine contraction. This is B. Late deceleration. Contraindication of nasopharyngeal airway is? The answer is A. Skull base fracture. Complication of high flow ventilation. Answer is B. Pneumothorax. Identify the FiO2 rate in the given Venturi mask. Answer is A. 40% can give in red color Venturi mask. A patient has calcium level of 7 mg per deciliter. ECG change seen is? Option is B. Prolonged QT interval. pH 7.25, PCO2 40, HCO3 22, sodium 150, chloride 100. The abnormality is metabolic acidosis. During suctioning, the patient develops respiratory distress. The first nursing action is? Option is answer A. Immediately remove the suction catheter. In a 3-year-old child, which of the following is the best complementary feed? The answer is B. Dal rice. A child is on CPAP and is hemodynamically stable. Which is the best method of feeding? The option is B. Nasogastric feeding. In a 4 mm ET tube, what size suction catheter is used? The answer is A. 10 French. WHO declared COVID-19 a public health emergency on B. 30/1/2020. In a newborn, APGAR score at 1 minute is 7. The baby's mouth is stained with meconium. What is the next best step? The answer is C. Perform suction of mouth and nose. Identify the ECG given below. The answer is C. Sinus tachycardia. Function of zinc in the management of diarrhea is? The answer is C. Maintains hydration. The best position for doing lumbar puncture is? The answer is A. Left lateral position. A child with diarrhea has sunken eyes, is eagerly thirsty and drinks eagerly. What type of dehydration is present? The answer is B. Moderate dehydration. Contraindication of nasal intubation is. The answer is B. Fracture of base of skull. According to WHO, what is the management of the second stage of labor? The answer is B. Monitoring fetal heart rate. Identify route of drug administration. The answer is B. IM with jet track. A patient has hyperventilation and the CO2 level is below the normal range. What is the priority nursing management? Answer is A. Paper bag breathing. Maximum Bharat Ratna Award were given in which year? The answer is B. 2024. Identify the hard one. The answer is D. Oil. The normal interval of the QRS complex is. The answer is A. 0.08 second. The flow rate of drug is shown as 50 ml in 15 minutes. The correct flow rate is 200 ml per hour. Core body temperature can be measured using all of the following method except. The answer is C. Temporal artery. A patient is prescribed 200 mg of BD. Available strength is 1.0 gram. The current dose for one administration is B. 2 tablets. In a patient, apical pulse is 80 per minute and radial pulse is 65 per minute. Identify the pulse deficit. The answer is B. 15. In a 35-year-old female, USG shows 2 mm mass and CA 125 is reactive. What is the diagnosis? A. Ovarian cancer. Desired dose of morphine is 0.4 mg. Available strength is 1 mg per ml. The correct volume to administer is. The answer is A. 0.4 ml. A 32-week pregnant mother has abdominal pain, tenderness, and fetal distress. What is the diagnosis? The answer is A. Abruptia placenta. An asthma patient comes to the emergency with wheezing and chest pain. What should be the oxygen flow rate? The answer is A. 2 liters per minute. A 5-year-old baby drank kerosene accidentally. What is the priority management? The answer is B. NPO till help arrives. If a female patient has a freely movable palpable 2 cm breast nodule with no nipple discharge, best investigation. The answer is D. Mammography. How to tie an ET tube to an adult patient to prevent bedsore? The answer is C. Cheek to cheek above the ear. Post-op patient after right side mastectomy, priority care. The answer is B. Take blood pressure from left side. According to IMNCI, danger sign of sick baby includes. The answer is A. Persistent vomiting. A patient in the ward suffers sudden cardiac arrest. Which method of intubation should be used? The answer is B. Head tilt chin lift method. Correct ratio of bladder length to width in an adult BP cuff. The answer is B. 2:1. Smallest syringe size for first use of central venous access device. The answer is D. 10 ml. Guess the next number: 150, 170, 155, 160, 180, 165. Answer is D, 170. A child is on chemotherapy. The nurse should teach the mother about the following except. Answer is D, stitch bath. What flow rate should be set when using a resuscitation bag? The answer is C, 15 liters O2 per minute. Furosemide injection is administered to a patient for which condition? The answer is A, loop diuretic to prevent excessive fluid volume. 54 is 18 is 62. The option is A, 16. A RTA patient came to the emergency room. By which method should oxygen be administered? The answer is A, simple mask. After taking blood from the blood bank, the blood transfusion should be started within. The answer is A, 30 minutes. In a 20% burns patient, how should we check the fluid volume? The answer is C, strict intake output. Which of the following is an indication to perform suctioning? The answer is C, reduced oxygen saturation levels. Mother of a 3-year-old child asks the nurse about instructions following the use of spacer. What will you tell the mother? The answer is D, time between alternate puff is 30 seconds. Which symptoms would manifest for a client with excess fluid volume? The answer is C, hypertension. Prevention of constipation when starting opioids. The answer is D, using a bowel stimulant and stool softener. Hypokalemia is seen in. The answer is D, nasogastric suction. Correct measurement of the oropharyngeal airway. The answer is B, corner of mouth to angle of jaw. Oropharyngeal airway is used in which patient? The answer is A, unconscious patient. Patient identification before medication administration. The answer is A. Patient tells name plus date of birth, check medication chart and check identification band. 28-year-old female with hysterism, make like hair, male like hair, which test? The answer is C, TVS ESG. G3P2 with previous cesarean section, risk of uterine rupture. The answer is A, 2 to 3%. Which medication should not be administered in treatment of CSD by lumbar puncture? The answer is B, steroids. Naproxen sodium 1 gram in 50 ml NS over 30 minutes. Drop factor is 15 GTT per ml. What is the flow rate? 25 GTT per minute. Which finding indicates that endotracheal tube has migrated too far down the trachea? Decreased breath sound on the left side of the chest. Which layer of the adrenal gland secretes glucocorticoids? Zona fasciculata. Identify this instrument. The answer is Hallis forceps. EMLA, a topical anesthetic, should be applied how long before the procedure? The answer is 60 minutes.